Hi everyone, I'm Dr. Anne-Sophie Lessard. Hello ladies, and welcome to Plastic Surgery Boutique. So you called us to have more information about a breast lift. So I'm here to give you a little bit more information before we meet. So usually how it works is that I will see you before the surgery. In consultation, I will ask to make sure that you're a good candidate for the surgery, and I will perform a full examination and some measurement of your breast. Depending how much laxity you have, we call it ptosis. So how low are your nipples on your breast? There's different techniques that can be used to give you a good outcome. The goal of a breast lift is to bring back your nipple up, but also to tighten the skin so they look more perky. It doesn't mean that we have to reduce the breast. Whatever you have as a gland and fat, we can keep it. The stuff that we remove is skin, and we lift the nipples. If you want a little bit of gland remove, we can do it as well. It can be like a small reduction. The three techniques is, one is a scar around the areola, just to lift a little bit the nipple. This is rare. It's only if you have just a little bit of ptosis, that your nipple are a little bit down. The other one is a vertical lift, and it gives you a more perky look by excising some skin in a horizontal fashion. The most frequent is the inverted T. That one requires a scar around the areola at the bottom, like a vertical lift, like the lollipop, but also at the bottom, we call it at the inframammary fold, which is the junction of your breast to your abdomen. That scar is well hidden and usually heals very well. Yes, it's more scar, but it's you exchange scar for perky breast. Most patients are very satisfied when they expect those scars. The scar, they take about a year to heal, and usually they heal super well. Initially they can be red and active, but after a year they usually settle down and they become white. In some people we can barely see it. So it's a surgery with high satisfaction. Depending how much work we have to do, it can be done under local anesthesia, it can be done under sedation or under general anesthesia. Some patients require to have implants. Why? The implants give you the upper fullness and a better cleavage. Some people want more the natural look with just the breast lift. It really depends on what you prefer. I'm here to help you. It's your body. You live with it all your life. So I'm really all ears, and I try to listen to you to understand what you want, and so you can be happy all your life after. The surgery is done in a surgical room. I do perform the whole surgery, and when you wake up after the surgery, I show you a picture of what we did, and then you go home. I recommend that you have help for the first 24 to 48 hours, and I see you after 24 to 48 hours to look at it at your breast, and also to answer your questions. I see you back at 1 week, then at 3-4 weeks, 6 weeks, and 3 months, 6 months, a year. Until you're healed and until you're happy. We don't do any revision for the first year because there's a lot of swelling, a lot of things that has to go in place over time. So you have to be patient. The surgery is not like the day after the surgery that you have your outcome. So we have to let time to do his thing and your body to heal. And usually any revision that you would need, which is rare, is usually a year after. It's a surgery that has low risk, small risk of infection, bleeding, anesthesia risk, the scars. Sometimes at the inverted T, the bigger technique, it can open up a little bit. When this happens, we just let it heal by itself, and if it needs a revision, we do it in the future. As I explained to you, there's a lot of scarring, so the healing process takes time, and one of the contraindications is smoking. So I want all my patients to not be smoking any cigarettes or anything 3 to 4 weeks before the surgery, and until you heal after the surgery, so after 3 to 4 weeks after the surgery. So it's a big commitment, but it's totally worth it so you can have the best outcome for all your life. I hope this helped, and if you have more questions, you can call the office. Otherwise, I'm looking forward to meet you in person. Have a good day.